Welcome, everyone. This is our fourth weekly Corona Corner chat, and I hope that you're all home and staying safe and healthy. I have to say that it's now the end of the third week of remote learning, and by all accounts that I've received and I've heard from so many of you, you've done a remarkable job of adapting to remote learning. I've heard from faculty and students, and by all accounts, it's going really well. And I'm so proud of all of you. It's really terrific to hear that you're so innovative and adaptable. I want to remind you that registration for summer and fall is open and ongoing. And so please, if you haven't yet registered, make sure that you do that. And I also want to remind you that progress towards getting your degrees is also continuing, and please don't forget to do that because this is really a terrific time to get on board and continue to make that important progress. It's a great time to make sure that you get your degree. I also want to remind our students and our faculty and our staff, as well as our many thousands of supporters, that we're still open for business, even if we're doing it remotely. And we're here for you. And we want to support our people in every single way and in every step of the way. So please know that we have thousands of people working remotely to help you. And in that regard, I want to applaud our staff and team for setting up the Student Relief Fund. It's been a very significant success, and already a number of students have availed themselves of the Student Relief Fund and are getting support. And again, I want to thank those of you who have given generously to the Student Relief Fund and students who have taken advantage of the Student Relief Fund. I want you to know that it is there for you too. You know, the COVID crisis is continuing both worldwide, nationally, and of course here in Michigan as well. Already there are more than 1 million people around the world who have fallen ill with the COVID infection. Here, as of today in Michigan, there are more than 11,000 people who have become infected with the COVID-19 virus, and many hundreds have already died. And so, since the majority of those are right here in Southeast Michigan, it really should come as no surprise that our OU family has also already been impacted. And so I have learned already that our family, the Oakland University family, has already been impacted. And what I mean by that is that we know that we have members of our community who have already become ill with the COVID-19 virus, and members of their families have already died. And so I want to now extend our deepest sympathy and condolences to those members of our extended OU community who have had losses. Our hearts ache for you, and we are so sorry. And if there's anything at all that we can do, we want to reach out to you and let you know that we are together as one community, and we want to embrace you. And we're there to comfort you as a general community. Michigan, of course, is a hotspot, and that is one reason why I want to remind you to please adhere to our rules and instructions to stay at home and to maintain social distancing. But when you must go out, for example, for exercise or to go to the grocery store or to pick up medication at the pharmacy, I want to also tell you that there are new recommendations that are likely to be coming out this week, probably from the CDC. And those include the suggestions that I think will come to recommend wearing a mask. And I will support those recommendations of wearing a mask. Now, general masks are not readily available, so these are probably going to be homemade masks. And if you can sew, there are all kinds of ways to learn how to sew homemade masks, and I'm going to recommend that you consider doing that. But I want to also, again, emphasize, don't go out unless it's absolutely necessary or for your daily exercise, and don't take a mask from a healthcare provider. And I, again, want to tell you why you're going to wear a mask. It's not really to protect you. You are not going to be protected by wearing a mask. It's to protect others. And that's what the recommendations show. And the reason is because we don't yet know who's infected. You could be an asymptomatic carrier of the COVID-19 virus. And that's the reason that we're recommending that if you go out to the grocery store or if you're going out for a walk, again, maintain social distance, but a mask is now recommended. We will have information on this that you could actually access and talk to one of our chats with one of our people at Oakland, and you can get this information on Engage with OU at oakland.edu. If you send a question there, we'll be able to have someone answer you. Clearly, we are living in unprecedented times, and most importantly, we care about the health of our people, both the physical health and the emotional health and the health of our economy. And we understand that this is really a time of great strain, both for the health of our people and the health of our economy. And yet, during this time, there are incredible, amazing, and inspiring stories. And we have just the most amazing heroes. So I want to talk now about 3 types of heroes. Our heroes are clearly the frontline heroes that are the healthcare providers. We have heroes who are the volunteers. And we have heroes who are all the rest of you. So now I want to read a letter from one of our healthcare providers, an alum of our School of Nursing, one of those who's on the front lines, and her name is Alyssa. And we just got this letter from Alyssa, and Alyssa is a brand new nurse who has a BSN and an RN from Oakland University. And here's what she wrote us. My name is Alyssa, and I am a clinical instructor and lab instructor. I'm also a full-time nurse working in the surgical intensive care unit at Henry Ford Hospital in Detroit. Currently, my unit is housing more than half of our census with COVID-positive patients. I wanted to share with you what it's like for my peers and for me. Going to work every day gets scarier and scarier. I have to get to work almost an hour before my shift to get a parking spot, and then I stand in a line with other employees to get screened. There is security at the entrance, as well as employees who are asking questions about symptoms and taking your temperature. I've been taking my temperature at home every morning and night since I've been taking care of COVID-positive patients. If you pass, you get a dot sticker on your badge. Then you get some foam hand sanitizer and go to your unit. Lately, when we start work, we're already low on PPE, personal protective equipment, and we're waiting for supplies to be replenished. My unit has been lucky enough to have respirators and face shields. Currently, the respirator doesn't fit me. So while I wait for a smaller size to be ordered, I'm wearing N95s. Most of the patients are intubated. All of the doors are shut, I just can't imagine how scary and quiet it is for the patients. At the beginning, we were met with a lot of anger from families because of the visitor restrictions. Lots of name calling, threats. The people are scared. Since the second week, people have been more understanding once they realized how serious it is. We are out of our normal isolation gowns. The procedure to get in the room is as follows. Foam, put on a gown. Foam, gloves, respirator, eye shields, foam. Put on your gloves. Do what you need to do. It's hot, you're sweaty. And the patients, they just get sicker and sicker and sicker. It's physically daunting. The patients, they're getting sick fast. At the beginning of the pandemic, one of my patients told me she would tell whoever is up there good things about me so that when she gets to heaven, she'll see me there. She made me cry. Luckily, she was able to move out of the intensive care unit, but she was so scared and so fragile. And I couldn't do anything to help her with that. And that's the worst part about this. We've never seen this before, and we don't know what to expect. We're doing our best, but it might not be good enough. I cry a lot. I'm a huge fan and an advocate for a good death. A good death is being around loved ones, family that can comfort you. But with these deaths, family can't be at the bedside because of the restrictions. This was my first year teaching, and I'm so sad that it was cut short. I miss my students every week. I don't have the answers. I don't think anyone does. But I hope that this won't scare people away from the nursing profession, because nurses do some really great things, and I know they will once this is over. I want to thank Alyssa, an Oakland University recent grad, for sharing her story with us, because nurses are doing really great things, and I want to applaud the heroes on the front lines. We have other volunteers too, and they too are our second heroes. And I know that last week I told you about our team. That's the Engagement and Mobilization Task Force. And I want to tell you about some of the incredible things that they're doing. We've been partnering with Lighthouse, which is a major Pontiac nonprofit organization that's providing for the homeless and those living in poverty. Today, 43% of Michiganders do not have basic necessities. And we've been partnering with 33 organizations who are now providing help and care to thousands of people in Michigan. And I'm going to take you on a walkthrough to show you what we're doing here in Michigan so you can just see what we're doing for them. Also this week, we opened up Hillcrest Hall, a 750-bed residence hall, to healthcare providers at Beaumont and at Ascension Health and for Auburn Hills so that they could use our facility. Again, these are heroes, volunteers from around Oakland University, our staff, our faculty, and many others in order to help them do more. And finally, I want to conclude by telling you that you are heroes too. If you are adhering to social distancing and you are staying home, you too are a hero. I know that this week we are actually about to celebrate Holy Week, and many of you are preparing for the holiday of Easter and getting ready to celebrate special holidays, and it will be different from the way you've ever celebrated in the past. For me and my family, we will be celebrating Passover. And this table is the table that I usually celebrate my family Seder, a big event where we have sometimes up to 40 family members. But this year, our Seder will be canceled because of a plague. Normally we talk about the 10 plagues, but our 10 plague celebration will be canceled because of the COVID plague. But we're going to have a Zoom Seder, and I hope that you'll also be having your family celebrations by Zoom or some other method where you'll be able to stay in touch with your loved ones by staying home and continuing to be heroes too. And now I'm going to take you on a tour to see our regional food distribution center in the Oakland Center so you can get a glimpse of some of the great work that's happening here by your colleagues and your friends. Have a good week, and I'll see you again next Friday.
The volunteers come and they grab one of these boxes, and then they go ahead and they sit it on the table over there, and then they just walk down the station. They grab their peanut butter, they grab their macaroni and cheese, depending on what's available at the time. We want to make sure that they've got a lot of vegetables, so we've got corn, and then we've got the pasta, some proteins here. Our team is here until 5, so if you guys need stuff dropped off, like, say, do you have all the masks?